Assalamu alaikum, everyone. Thank you so much for
One
joining.
second, I've not connected to it.
All right, then.
You can continue, but it might echo a bit until I've
That's
connected.
fine. Okay, so this is the Sudanese Diaspora Network's panel discussion where we've brought together a few different medical professionals and other healthcare related professionals to talk about medical WhatsApp myths. And our aim here is to stop the misinformation and provide, using our expertise, to just give the right information to relieve all of those anxieties going around, especially within the Sudanese community. So if we go around, introduce ourselves, if you just tell me your name, what you do and where you're based. So Reda, if you can start. Unmute.
I was on mute. I got myself. So my name is Reda Mahjoub. I'm based in kind of the Washington, D.C. area. I'm currently right now finishing up my first year as a Doctor of Public Health student at Johns Hopkins. And then I am also working full-time at the Environmental Protection Agency. So we do a little bit of health, we do public health work, not just environmental work as well.
Great. And Nidal, can you tell us about yourself? Nidal?
Yeah, my name is Nidal Bashir. I'm based in South Sudan. Yeah, can you hear me?
Yeah.
Okay, my name is Nidal Bashir. I'm based in Saudi Arabia, but currently in Sudan. I'm studying medicine. It's my final year. You know, Corona just ruined everything.
I think that'll be useful hearing a bit about how things are in Sudan and the stuff that you're hearing from people there. Umnia, can you tell us about yourself?
Hi, I'm Umnia Khalid Mohammed. I'm a graduate from King's College London with a master's in chemistry and biomedicine. I'm currently a research scientist in Oxford Nanotechnologies. And yeah, I'm based in London. So yeah, that's me.
Great. And Mohammed, please.
Let me mute. Okay. Yeah, so I'm Mohammed Bashir, based in Arizona. I'm an internal medicine resident right now. I know the terminology might be a little bit different. I know, UK versus, the US terminology. I'm not sure what the resident is, but essentially, in training to become an internal medicine.
So yeah, so we would call it like a specialty trainee or maybe a registrar if that's your level. Yeah.
I think so.
Great. Yeah.
I think so. Yeah. Well, thank you for having me.
No, it's a pleasure having everyone. And Mandoor?
Assalamu alaikum. So I'm similar to Mohammed Bashir. I'm a specialist registrar in London in internal medicine and hepatology.
Great. And I'm Abrar El-Nil. I'm a junior doctor. I currently work in accident and emergency in Manchester, and I'll be moderating the discussion and then jumping in. And so, first of all, one thing I think is useful, maybe just to preface as a disclaimer, is that when we're talking about myths and WhatsApp, it's not here. The aim isn't to mock anybody or anybody that's spreading this stuff, because I recognize a lot of this misinformation comes from anxiety. What do you guys think about why people are sending about all of these pages long WhatsApps, videos, voice notes? What do you think about all of them going around?
I mean, if I can start first, I think it's mostly anxiety. I mean, anxiety is kind of the trigger for all these, WhatsApp messages. It's just a sort of information, because a lot of our information nowadays in our Sudanese community comes out of WhatsApp. It's just the factors are just easy, easy to use, easy to distribute information, and that's why I see a lot of that information is done through WhatsApp.
Yeah.
I also, it's to do with comfort as well. So for example, certain cures that somehow help, that kind of gives people hope, and then people kind of kind of don't validate that. So I think that's also part of it. And I think it's kind of linked to obviously anxiety.
Sure. And I think everyone feels kind of helpless in this situation. So having something to cling on to that makes it seem like that will help, that will cure them, I think, like you said, would bring them a lot of comfort. What were you saying, Mandoor?
I mean, I don't think it's an isolated problem to just Sudan. If you look at what happened in the West, for example, in the United Kingdom, misinformation was being distributed, widespread about 5G. People are saying, "Oh, there's no such thing as the coronavirus, it's 5G, etc." That was going across all over the WhatsApp. So, I don't think it's just an isolated problem per se, misinformation with Sudan, but certainly, yes, WhatsApp we know plays a major role in in Sudan in general. So.
And I think it's also the fact that WhatsApp is the social media. It is like a social media tool that a lot of Sudanese people use. And the same way that I use Twitter, I get a lot of my news from Twitter. So I'm not fact checking all of that. Or people that use Facebook predominantly or Instagram. So I feel like it's all the same thing. Social media as a tool for communication, but there's no fact checking. It's also miscommunication, right? Sorry, Ghaida, I think I interrupted you.
No problem. Yeah, I was going to add, I think it's also a matter of trust. So trust in the government and trust in the scientific community. So that varies from population to population and country to country. So I guess people might be more willing to trust scientific information if they've had good experiences in the past. And then maybe like less likely to trust medical communities if they had bad experiences in the hospital system or that kind of thing.
For sure. That's actually a very good point. Yeah. And Nadal, anything to add to that?
Yeah, I just want to talk about the rumors in Sudan that started to spread over Sudan about there is many rumors in Sudan about it started about a baby in one of the states of Sudan speaking in the cradle and then he died. He said the treatment of the virus is to drink a cup of tea in the early morning and pray to Raka. People start believing that and do it. This is the saddest part about here in Sudan. People believing things like that, and they don't believe about medical or a doctor and all these things. Also, there is a rumor about a woman. She said that she has dreamed about the Prophet Muhammad sallallahu alaihi wasallam, and she said he told her open the Mus'haf and take the Surah Al-Baqarah and you'll find a hair on it. So take it and put it in a cup of water and drink it. People start also believing this and do it. There's a lot of rumors in Sudan. I don't know how people believe it actually, but there's also a rumor about Burahinna on children's food. So this as protection against the virus. And people start doing this also.
So Nadal, I'm glad that you've started bringing some quite outrageous stuff out there. And so some of them, so let's talk about whether that's harmful or not at all. So, I mean, what do you guys think? Do you think any of that is actually harmful for people to believe that though?
After you.
Yeah, sorry. No, sorry.
Go ahead, Mandur.
It's quite interesting because it reminded me of this was a couple of years ago when I was having a lecture from a professor of infectious diseases, and he was talking about how people in the rural villages of Africa suffering from snake bites, rather than seeking medical attention, they'd go to their local doctor, their witch doctor. So I asked the question. I said, well, if all of these villagers don't believe in medicine and they go to their rural witch doctor, surely, when these people are dying from snake bites, they'd stop believing. So what he said to me was quite interesting. He said, well, we know that 50% of people who get bitten by snakes will recover. They'll automatically recover. And it's those people that have recovered who have gone to the witch doctors, people automatically associate that recovery with the witch doctor. So it's a similar thing. So with COVID-19, we know 80% of people will have mild symptoms. They'll probably go to their local faqih or whatever, and they'll get better. They'll get better not because of what he's done, but because they just recover, and automatically they're going to associate that recovery with that person.
Yeah.
So just to answer Nidal's question in terms of why do people believe these things, I think this is a factor.
Yeah. And I completely agree with you, Mandur and Nidal. I mean, these things have been going on for quite a while in Sudan. And I think this issue goes way back, and it's beyond just, what we know. I mean, this has political, historical factors to it too. It's not, and obviously education plays a big factor in this. And I think the biggest problem in Sudan is accessibility to care. Because a lot of these people in these villages, kind of like Oscar villages, don't really have, the accessibility that people have in Khartoum. I mean, even Khartoum doesn't have the best healthcare system, but I'm talking in comparison. Those people in those villages, they don't have that accessibility to care to those, compared to people who are in Khartoum. So they would eventually, they definitely need some sort of guidance as far as how to take care of themselves and how to get information. So their best source that they can find is within their villages, probably the sheikh or the faqih in that area. So they probably seek their guidance because it's probably the only person that they can go to for kind of medical help. And there's also an issue with trust, because there's always that issue with not trusting foreigners, right? Not trusting people from outside of the village. They always have that respect for someone. It's easy for them to basically trust someone who is in their village, someone that they know, versus someone who comes as an outsider to their village. So there's always that component.
Regarding this, do you think there's responsibility then for medical professionals to be going out to rural places and educating whoever does the primary, most care? So whether it is going on convoys to rural areas, discussing things with the shuyukh, imams, the midwives there, because they're the people that spread the information. Do you think there needs to be that kind of initiative?
Exactly. Yeah. So I think from our standpoint, it's easier to spread information that way. Educate those who are already trusted by the community, and then those people will spread the information a lot faster and a lot better than what we can do. I mean, we still can. I mean, I don't want to discredit our work that they were planning to do, but I think educating those who are in the community, the leaders in those communities, will be key.
Yeah. And I guess that empowers that community as well. And they already have that trust with that person, whoever they go to for that assistance, they will trust them. Okay, right. That's a really good point. I'm really glad we touched on that. So Nadal's already come up with some stuff that I find really interesting. Let's go around. I want to know what the most outrageous thing that you've heard has been. Ghayda, what have you heard that has kind of made you go a bit and when we can talk about it and go through, is that actually fact or not?
Okay, so I heard of two things. So one of them, let me write them both down, of course, because I always forget my second point when I say my first point. So one of them was, so people were saying like when we call back home and stuff in the Khartoum area, they're still going to the masjid to pray. So they're like, you want us to stop praying and just go sit at home and wait for the coronavirus? It's just they're basically saying why are you telling us to stop praying, kind of thing. Right? They don't understand the concept of how are we supposed to stop praying if God is the only person who can take this away from us, kind of situation. But there's other things you can pray at home, but we can get to that later. The next thing I've heard of was there's a WhatsApp audio going around. This is actually the first, the only myth that I've heard. I haven't received many of them, but I received this one today, and it was basically saying, this guy recording audio saying there's a vaccine coming from the US and don't answer the door if somebody knocks on the door and says we have a vaccine, because either it's going to kill you or it's going to give you the coronavirus itself. So this made me scared because yeah, there is no vaccine. You shouldn't trust anybody at this point. But when a true vaccine does come out, now you've made people scared of the vaccine. So people are not going to get vaccinated later on because they don't know whether to trust it or not anymore.
So that I find those kinds of rumors very damaging, because it's not even somebody, Nadal was saying, okay, putting a bit of henna on a child's hand. That's it creates the harms that Mandor was talking about, in terms of it reinforces that there is trust within that person giving false information, but the actual action isn't harmful to put henna on a child's hand. But the action of going to a masjid, praying in Jama'ah, that is harmful, because people who don't know if they're carriers, they are spreading it to other people. And then even that other thing about the vaccination, discouraging people from getting the vaccination, that itself was harmful. So I think there's those two massive groups of rumors. So let's talk about that one about the masjids, because you said you were going to come to it later. Let's just talk about it now, and everyone else can pitch in.
So I think it's like it's a general like concern for all Muslim countries. So like people like wanting to go pray at the masjid, like they want, especially during Ramadan, to have like the environment of like the community environment. But like there's the famous hadith going around where it says like the Prophet Muhammad ﷺ said, like, you know, if you see a plague in a community, don't go into the community, or if there's a plague in your own community, like don't leave your community to spread it to other places. Like, you know, so we do have a responsibility there. And then the other thing is like, so we don't understand that, okay, we're going to go pray and we think like we're basically like a bad Muslim if we don't go pray at the masjid, but the same, like we've kind of delved in our minds, like, you know, praying at the masjid is better, like go pray at the masjid. We've kind of like ingrained that in our minds. So people, it's hard for people to like not go pray at the masjid. And then we don't understand that we are like unknowingly spreading the disease to other people. So will we not be held accountable for the people that we've made sick? And like, so I guess we were carrying a lot more I guess deeds, like negative deeds, because we're spreading this illness and we're not listening to the rules. We're actually breaking the rules of the country and the rules of the land, which we do have a responsibility as Muslims to follow. So it's kind of like you have to look at it from different perspective, but also deen in our responsibility. Like killing one person is equivalent to killing all of humanity, and saving one life is equivalent to saving all of humanity. We tend to forget those hadiths sometimes and go one-sided.
It's difficult when things are like fixed in culture though. To kind of like discourage people from doing what the norm is. And that's why I think lockdown in Sudan is such a struggle right now. Aside from all the financial issues that a lot of people would be experiencing and hardship, it's also the culture. Like people, it's not our culture to not go and visit somebody. If somebody's died, we have to go. We have to go and pray for them. We have to go and assume. If somebody has an important event, if somebody's sick, we have to go and visit them. And that's going to create a problem as well. So it's culture that is going to be difficult to break down. Okay, so Mohammed, anything like, especially, I mean, there's a lot of stuff that is shared, I guess, globally, but being in America, is there anything that you've heard there that more so that has made you feel a bit shocked or worried?
I mean, kind of similar what you guys have been talking about in terms of what's going to be, you know, because the hardest part, like you said, is breaking our cultural norms. You know, the Sudanese community, we like to get together a lot, especially during the month of Ramadan, and that's been kind of hard on our community. But I think for the most part, at least from the Arizona community, the Sudanese, they've been, you know, kind of doing pretty good in terms of staying away from, you know, big gatherings and kind of practicing the good precautions that we're all supposed to do. So I think our community in Arizona, they're doing a good job of maintaining a good health and keeping away from the bad.
Inshallah, it stays like that.
Alhamdulillah, yeah.
But what Mandor was saying was that it's not just the Sudanese community. In America, obviously, there's Trump talking about bleach and disinfectants and UV into our lungs. I'm not sure. Like, as a internal medicine resident, have you seen any repercussions from those kinds of rumors or just misinformation amongst your patients? Like, how's that affecting you in your practice?
Well, unfortunately, I mean, haven't seen personally on a personal level, haven't seen any of those, but I've heard actually, because I know that actually of a couple here in Arizona who died because of because I know Trump in the beginning of this COVID-19 situation, he was talking about how to use hydrochloroquine as a possible treatment, and there's a couple in Arizona who went out and actually bought, I believe it was some sort of a fish.
I think I heard about this. Was like fish cleaner or something, fish tank cleaner,
something like that. Exactly. Yeah. And it has some hydrochloroquine, I guess, component into it. They thought if they can drink that, they'll be able to prevent the disease. And unfortunately, they passed away. So that's also one of the reasons we have to be careful about what information we tell people, especially because people look into professionals, look into people in the leadership positions.
Yeah.
It's really important to kind of to make sure what information you distribute and tell.
I mean, I'm going to do a similar question to you as the equivalent of internal medicine resident in London. Have you seen this affecting your work or the patients coming to you?
Not necessarily the bleach. Certainly the hydroxychloroquine. Certainly, yeah, because patients would come in with coronavirus, extremely sick, and you'd have relatives on the phone, or why are you not giving them hydroxychloroquine? They'd be so much better with the hydroxychloroquine. You're killing my mom, you're killing my dad because they're not having this drug, this miracle drug. You know, and there's no evidence really. And actually looking at the French data, it doesn't work. So certainly that's one issue we've had, but not from bleach. But, you know, being as a gastroenterologist, I see the consequences of ingesting bleach. And, you know, if you don't die, you will certainly end up with significant long-term damage. So hopefully, you know, the people of the United Kingdom won't listen to Donald Trump.
It's very interesting. I went on Talkspace, which is the website for looking at the effects of all toxins. So if somebody's got an overdose, I'm just looking at something else, and it had a big box about warning about ingesting bleach and what to do. And it just felt very like amused to me. They were really anticipating people coming into A&E having done that. And alhamdulillah, it doesn't seem to have happened much in the UK. But let's talk about hydroxychloroquine, because I've heard a rumor, I want to see what you guys think about this, that the reason that Sudan hasn't been as affected as the rest of the world is because so many people have taken that formulary in the past that has helped give them some kind of immunity to COVID-19.
Can I answer that question?
Yeah.
So I think, to be honest, I think the numbers are not exactly representative of what's going on in Sudan. The number that we see in terms of, you know, the people infected, I don't think it's the true number. I think that actually the number of people infected is way more than what's being reported. And that's why I don't think there's any sort of immunity. Maybe there is. I mean, I can be wrong for sure, but based on what I can see, I kind of predict. I think the numbers are way higher than what's reported. I think just the testing is not as available as, you know, other countries. So I think that's why we're seeing a lower number, but just kind of based on the number of people who got infected. And, you know, as we know, COVID-19 has an exponential infection growth. So, I mean, there's only, you know, I think last time I've seen it was like 500 something people infected. So I'm almost certain that there's going to be, you know, people infected in the thousands, if not more.
Yeah, I think you've touched on a very important point there, Mohammed, because people are putting too much emphasis on number of cases, when actually, if you look at it holistically around the world globally, no country has tested every single case. And that's why until today, you'll never know what the mortality rate is, because if you don't know how many people are infected, you're never going to know actually what the mortality rate is for this virus. And Sudan, you know, they've not been testing people. If you don't test, you don't know how many cases there are. And that includes deaths as well. I wouldn't be surprised if there's many more deaths secondary to COVID, which have not been diagnosed. So I think that's a key point.
And I think the other issue is, I'm sorry, go ahead.
No, go ahead. No, go ahead.
Yeah, I think the other issue was there's a stigma in our culture, in the Sudanese culture, that there's a stigma that we need to break about how, you know, once you're diagnosed or we have any sort of symptom, people don't like to report their symptoms because there's a stigma of having a coronavirus, you know, labeled on you. So a lot of people don't like to go ahead and, you know, seek medical attention unless they really have to. And that's also another problem that we need to address too.
And that's a problem because everybody in their house could become affected and then go on to affect other people. Now that's a really big issue, and that's going to be something really difficult to deal with, I think.
I think what's more concerning is actually, if you look at the data coming out of America and the United Kingdom, 70% of the patients in the intensive care units are from Afro-Caribbean backgrounds. And I don't think that this is just due to the socioeconomic status of these people, because many of them are doctors and, you know, people in higher salaries. So I certainly feel that in the next couple of months or years, they will discover a genetic element to this, which is why, you know, I suspect Africa will probably do much worse, not just because of the inadequate medical facilities that we have. I think genetically, Africans will probably do worse with the coronavirus.
And that's, I think that's a really interesting point. I think in response to a lot of people saying that Africans aren't affected, Black people aren't affected, the hot weather doesn't affect us. I think those are lots of points that I was hearing from February, March, because Africa wasn't as didn't have as high numbers as the rest of the world. But you're right, what we see here, and I'm sure it's reflected in America as well, and I've seen studies of that, it's the same in New York amongst the Hispanic and Black community. But what we see here is exactly what you're saying, Mundoor, is that it's a lot of, proportionally, the number of Black and ethnic minority patients is higher than the proportion of those people amongst the population. And I don't know about that. I think we'll find out maybe in 5 years what that's all about, because we know that there is a difference in how different ethnicities are affected by like blood pressure, kidney disease. There's a lot of things that we know that there is some kind of discrepancy. But there is also a conspiracy about that. That it's okay. Well, let's talk about this myth that we've heard, that this is all about population control. That it's something that has been man-made, biological. Not necessarily biological warfare, but it's been put out by certain governments to cull the population because financially the elderly are a strain on the economy, but also some people have taken that further because of the higher rates of ethnic minorities dying from it, that it's actually something against them in particular. Anything to say about that?
I mean, if you want to go ahead, I mean, if you guys want to talk about that.
Reda, do you have any thoughts on that? Like people talking about population control, just from a public health point of view?
I don't know. I can't really like say anything because there's not enough evidence to even begin to give a accurate answer to that. But I think naturally there are like the Earth kind of does reach a carrying capacity, and there are like natural like population control things that happen throughout history. So we've seen like there's a 1920s pandemic and there's an 1820s pandemic. So I really can't say much about that. But in terms of like whether it was intentionally created, what I've seen in like some of the resources that I've read, like nobody, like people, like majority of the people are saying this is not something that's man-made or intentional. But that's like the evidence that I've just seen.
I mean, like, what is the evidence that it's not being man-made? Because that's what most people, well, not most, a lot of people I've talked to, especially family in Sudan, do believe that it is something created by one government or another and got out of control.
Right. Well, to add to Aida's point, I think the coronavirus is not it's not a new virus. The COVID-19 is a new variant of that family, but the coronavirus family is not new. We have seen coronavirus outbreaks in the past. We know about the SARS in the early 2000s and about MERS in the 2013s. But the family is well known. So I mean, we're all, as medical professionals, all taught this family. So it's nothing new. It's just a variant. Kind of like the same with any sort of other virus. They mutate and new viruses come up every now and then. You're gonna have a pandemic. It's just something that you can't really prevent or predict. I mean, you can predict that it's gonna happen, but you wouldn't be able to know exactly when. So I wouldn't be surprised if there will be another pandemic similar to this in the future.
And I think because a pandemic, it's just part of the natural cycle of things. There've been pandemics in the past, there'll be ones in the past, there'll be ones in the future. And I think something that's kind of encouraged a lot of speculation is because people see people like Bill Gates 5 years ago talking about there will be a pandemic and we need to create a vaccination from now. And that has I think that has, for a lot of the conspiracy prone people, has triggered their mind to think, oh, well, people knew about this. But then we know from the public health point of view, and then infectious diseases looking over the last few centuries, that is just what will happen. Evolution happens, the viruses mutate, and
to add to that, so I think many of that came about because we had Zika, we had Ebola, we had like these warning signs that there's a potential for a disease that could spread far and wide. So people kind of had like these like signals that something is going to happen, just kind of like looking into the healthcare system. So we've been speaking for a while that our healthcare system is not prepared to handle like a surge of like people becoming sick. And so I think it just comes from like people, like it's not like that they knew about the coronavirus or that they knew like something was going to come about. It's just like we've seen warning signs, we've seen Ebola, we've seen Zika, we've seen like these other diseases, and so it was just kind of we had to. It was something. It's kind of preparedness, kind of like hurricanes. Like you know there's a hurricane coming, but you don't know for sure like all the details and stuff.
There's certain things that I know people are doing to help protect themselves. Things like bukhur and garad and things like that. Like Umnia, do you have any thoughts on those kinds of practices?
I'm just gonna unmute myself. Yeah, so there usually are good benefits to remedies and home remedies and things like that to kind of help your immune system, which I think is good. So yeah, like I know ginger and like just things like vitamin C, so like oranges, lemons, fruits, vegetables.
I've heard
like
mango,
that.
apparently.
Yeah, exactly. Yeah. And gharad, I don't know. Could be that it could have some benefits to it. But yeah, but I think another thing is social distancing, of course. Making sure you wash your hands, that's the main thing, because the virus is spread through coming through your nose or mouth or touching your eyes or face, just in general. And like controlling your hands is quite hard. Like I touch my face a lot, like you've seen me doing this a lot, so it's quite hard. But always making sure you wash your hands and hand sanitize. Another thing with masks, I'm not sure. Some people say it's okay to wear, some people say, you know, necessary if you're just walking around, if you don't have. But I think it's important if you think you do have the disease. It's just a way of not spreading it to other people. And if you think there's other people around you that could have it, then I think it's good in terms of transmitting. Even though that we know that it's not really a airborne disease per se.
There's a lot of people talking about the airborne disease aspect of it. A lot of people think that it's been airborne, or I've personally received a lot of questions in WhatsApp saying about, is it actually not a virus, it's a gas that is spreading? Does anybody want to like kind of comment on about the fact of how the virus spreads and how that affects what the advice that the World Health Organization gives to us?
Yeah, I can touch upon that. Let other people speak as well.
Go ahead.
So it's not airborne, it's like spread through droplets, respiratory droplets. So if you're coughing, if you're sneezing, if you're talking next to somebody, naturally like water comes out of your mouth, like droplets come out of your mouth, moisture comes out of your mouth. And so that can carry the virus and spread it to other people. And then if you touch things that somebody has touched, like and the virus is still active during that time, then and you touch your face or your mouth, that's why they say don't touch your face or your mouth, because if you touch a surface that was contaminated and then you touch your face and stuff, you can ingest the virus, get the virus inside of you. But we don't know, well, there are some research of like how long the virus survives on surfaces. So there's some research on that. Like there's research on old coronaviruses, and there's some new research now on new coronaviruses and how long the virus survives on surfaces.
So I just want to like ask anybody watching, if they want to in the comments, they can ask us questions and we'll get to them. Just ask them from now and we'll like get through them over the next 20 minutes, because I mean this conversation goes by quite fast. So Reda, what you're saying is that the droplets, and I think that's what's important for people to know, to understand how they can protect themselves. So we've been told in our hospital that if somebody who has confirmed COVID-19 was to be some kind of aerosol generating procedure. So for whatever reason, they've had lots of aerosols containing the virus in the air, that stays in the air for 30 minutes before settling to the ground. So we know that it's not traveling in the air, it just lingers in the air and settles on the surfaces that need to be cleaned. And that if I was to cough and I had it, that it'll be 2 meters away that could reach. And that's why we're being told, stay 2 meters away from each other, social distance, don't get too close to each other. So yeah, there is a scientific basis from the advice that Public Health England, World Health Organization are giving to people. So
I've always questioned that, actually. I have to be quite honest with you, because some studies say 2 meters. I've seen a study that said 4 meters, And then you're talking about large droplets or smaller droplets, because smaller droplets can travel even further. I mean, Reda can get back to me if I'm wrong with this. But, you know, I've seen a study that suggests it could travel, you know, 4 to 6 meters, which makes me actually question this 2 meters rule. Is this 2 meters rule science-based, or is it just a method to control people's behavior, i.e. to stop panicking and looting and etc. and other things that, you know, happening in, you know, in the supermarkets? Because actually I'm not sure whether keeping people 2 meters apart is sufficient. I have to be honest.
Yeah. Well, I mean, so I was going to say that's an issue a lot of people have with not trusting the information that we've been given. Sorry, Reda, go ahead.
No problem. No, I agree with you. Like, we're not certain if the 2 meter works, because people have said for years, like, a sneeze travels miles, right? So we can't tell people to stay miles apart though. So it's like, we don't know if maybe it's a balance of both science and like what's practical. We're not 100% sure.
Yeah.
And then we also, Umni, I think you were talking about surgical masks and the use of them. So I think that's something that a lot of people are sensitive about. There's a lot of places in the world where it's compulsory to cover your face when you leave the house. You can be fined in some Middle Eastern countries if you're not covered your face. In the UK, that's we were told from the start, do not wear masks. It's not helpful. Of course, in a healthcare setting, we wear masks. And we have different types of masks for different procedures. But what do you guys think about wearing any kind of face covering, going out in the community, going to the grocery store, going on your way to work? What do you guys think of that? Because the guidance is so different internationally.
Yeah, so this is a hot debate, a hot topic. I don't think there's a consensus as far as what is, you know, what's the best way to advise people in regards to masks. I mean, even here in the U.S., people have been kind of going back and forth as far as what's the best recommendation. The current recommendation is to wear a mask. I personally, I mean, this is, you know, take it with a grain of salt. This is a personal advice rather than, you know, kind of a scientific-based advice, because there's, you know, there isn't really much, you know, out there in regards to, you know, what's the best advice. As far as masks, for me personally, you know, kind of if this is an advice that I would give to my mother, you know, or my family members, I would say definitely have some sort of covering around your face, because at least you're going to decrease the amount of secretions that's going to be coming at you. You know, I know there's different levels of protection that different type of mask or different type of covering will give you. For instance, the surgical mask, there's the N95, which offer good sort of protection. But the issue is, as a, you know, the medical professional, there's a limited supply. I mean, even in there's a very limited supply, and that's even us as you know, medical doctors here, we're limited as far as how much we can use. In the past, it was, you know, it was fine. You can use up to, doesn't matter how many you can use in a day. But now we're only limited to use just one a day, and it's not optimal. It's not ideal, because there's also a risk of transmitting disease from patient to patient while wearing the mask. I mean, it might be protective to yourself, but not necessarily to other patients. So that's an issue. So but I think for the general public, I think wearing any sort of protective gear around your face and nose, you know, around your nose and mouth area, covering, you know, areas where the virus can enter, you know, into your body, I think it would be advisable. But again, you know, there's variability as far as what can protect you and the level of protection that you can get from the different gears that you can have.
I mean, Mohammed, I have to agree with you on a certain level that, like, I do think there's a lot of benefit from covering your face in terms of protecting other people from you if you're a carrier without knowing, which a lot of people are, because it takes possibly 14 days before you start showing symptoms after being infected. So you don't know if you're a carrier, and you could be spreading those droplets to everyone else. The problem is with the mask or any face covering is just when people aren't used to wearing them, how they may not be being as sanitary as they could, in terms of when they're taking it off, their hands getting contaminated, not washing their hands effectively afterwards, or keeping it on for too long. And there is evidence that when you have a mask on for too long, it ends up being a vector for disease, because there's this moist space where you're breathing out onto it that is prone to, it's like a petri dish where it's prone to having bacteria and viruses lingering there. So I think there is risk if people know how to use it properly. I think that there's no harm in doing it, but there's a lot of potential benefits. Nidal, I want to know actually from you, like in Sudan, are people covering their face? Are they wearing gloves? I know there's a shortage in these things, but have you seen people changing their practice? I'm sorry, Nidal, you're just unmute, please. Nidal?
So at the beginning, people, they don't believe in. Yeah, can you hear me?
Yes, thank you.
I said at the beginning, people, they didn't.
I'm really sorry, Nidal. I think it's cutting off. I think you're talking about how at the beginning people didn't believe in covering.
Coronavirus.
Oh, okay.
They live in. Oh, everyone. Can you hear me? Because
Yes.
I'm using the and it's the beginning. People, they didn't believe in coronavirus, so they keep.
Okay, Nidal, I'm sorry it's cutting off. Like, let us know when you're able to get better connection again. Okay, I'm sorry, Nidal. I'm just going to continue, and then when you're able to like answer fully. Okay, I'm really sorry, Nidal. There was one question that somebody asked on our on the Facebook Live. So I think this is Tabarak saying, how is the EPA responding given the budget cuts? What are some challenges you're facing? So I don't know if somebody, is it America? Somebody might can clarify to me what EPA is.
Yes, EPA is the Environmental Protection Agency. So she's talking about the agency where Nidal is back. Nidal, are you able to talk at the moment?
Oh yeah, there she is.
Yeah.
Okay, awesome. Yeah, let's go back to that question.
No, you can again first, okay? But I didn't hear the question actually.
Okay, we'll just Nidal, if you just can talk to us about how people in Sudan are responding in terms of their behavior socially. Are they wearing masks? Are they wearing gloves?
Yeah, they actually people, as I say, they didn't believe in coronavirus in the beginning, but now, alhamdulillah, everyone spread awareness everywhere, and they wearing face mask, and they holding sanitizer. And they tell, even the kids, they telling you to wash your hands, don't go out, stay at home. This is a good thing actually, but.
Okay, I mean, I think that's important. I'm glad to hear that people are actually following that appropriate advice and changing their behavior. So, and Ghaida, coming back to what you were talking about.
Yeah, so I can't really speak for the EPA because I also work for the watchdog for EPA. So a lot of things are classified, which I can't really disclose. But anyway, I'm talking as a private citizen right now. So pretty much there's a balance of infectious disease and chronic disease right now with the coronavirus, which is interesting because we have been shifting towards a more chronic disease community and not so much infectious disease. But something like the pandemic comes along, which is infectious disease. But what we're doing is we're responding with a lot of carcinogens. We're responding with a lot of disinfectants, Clorox, a lot of sprays, a lot of like decontamination that kills cells and may cause cancer in the future. And so we have to be aware of what we're using and if we're kind of putting ourselves at higher risk of chronic diseases later on. So it's kind of like a balance of illnesses here.
That's a lot of
That's a good point. That's a good point, like that you bring up. That's why it's always important to have that kind of team approach for everything, you know, because as you know, I'm being very straight honest with you. I haven't really thought about that long-term effect, and that's why you guys, you know, on board. Is just awesome.
It's like the MDT, the multidisciplinary team that we have, which is great. On that note, I also like Umnia. I brought in here as well because Umnia is working in. She's research scientist, as she said, working in developing, kind of optimizing the current tests, and I think this hour session maybe isn't enough to go into more stuff, which is, you know, having gone through some of the myths, why it's important that we respond using science and medicine and the advice of professionals. After that, we can talk more so for quite a lot in length about, you know, what do you do if you do get it? I mean, we have, alhamdulillah, Mundur is a survivor. Maybe he can tell us about, you know, that own personal experience about what it's like when you get it. How do you actually protect yourself? We talked a lot about that, and what the actual research going on at the moment is, because it is a lot of research. We've touched on some of it that Omni's could talk about, and then other like antivirals have been going on. We've got like 5 minutes left of this conversation. So if you wanted to, we could have like a part 2 talking a bit more in length if some of you are up to this, or if our people watching would want it. But go ahead.
Yeah, I just wanted to add a quick to the gloves.
Yeah.
I think the gloves is actually necessary to protect, because, you know, the virus, you know, the skin is not really, it hasn't been shown, at least it's the way, you know, how the virus enters the body. So I think it's actually would decrease, because, you know, it gives us that false protection that, you know, so, you know, wearing gloves, so I'm not gonna wash my hands. So, you know, so I think, you know, having gloves on can protect you as you know, going out. But I think in the long term, you're gonna forget, you know, go ahead and, you know, touch your phone, you know, touch your, you know, face unintentionally and all that. To give you that self-belief, that, you know, that false belief that, you know, I'm protected while wearing gloves. That's why gloves, you know, I'm 100% with the, you know, advice with the mask, but not so much with the gloves. I think the gloves can be actually a little bit risky. So they, you know, actually advise against gloves.
I agree with you there, Mohammed. I think people end up going to the supermarket, they end up touching their phone, touching items, touching their purse. They'll take off their gloves, but then all of those things will be contaminated. So it's a false sense of security. And I think that is risky. Yeah. So there's a lot of other submissions through our Instagram story that people like of myths that they'd heard. And maybe we can just talk about a few of them in these last couple of minutes. I think there's a consensus that none of this stuff is true. But we mentioned the 5G story earlier. That was something I've heard a lot of in the UK. And I've even had colleagues vouch for this. One of my nurse colleagues vouched for this because she saw a map showing that in the past, where they put up 4G towers, there ended up being higher death rates in the vicinity. And now where they've put up 5G towers, there ends up being death rates in the vicinity. And I think that raises a very interesting point of how science and data is misused. What do you guys think of that?
I mean, it's interesting, actually. The rationale behind this was, I remember somebody telling me, "Oh, I've been seeing I've seen this video about 5G and all of these videos of dead birds everywhere, and all of a sudden there's this associated link between 5G and how come construction workers are the only people allowed out whilst there's a lockdown, or you go out during lockdown and you see that they're working, you know, doing road work, etc. This must be the 5G." To be honest, and quite frank and honest, I think it's dangerous. I think it's a shame, really, for all of the, you know, frontline health workers that have put their necks on the line and sacrificed their lives for something to be put down to a far-fetched rumor such as, you know, 5G. I mean, I don't know whether there are detrimental, you know, risks to your health long term from 5G, but certainly what we're experiencing now is not 5G. It's a real virus.
I think one thing that I think has helped, that has made it really difficult for people to have some trust into the facts that professionals are putting out there, is because of how contagious this is. In hospitals, we've had to put in a lot of measures about visitors coming in. So no patient is allowed to have visitors. In accident and emergency where I work, the only patients are allowed to have somebody with them in A&E in our non-COVID side is if they've got quite advanced dementia or very specific comorbidities, but then there's no visitors on wards except for palliative care patients, and that's only 1 hour every day. And I think what that's caused is because people can't see their family members in hospital, they can't trust what's happening to them. They can't trust the care they're receiving. And when unfortunately some people have passed away, because they've not been there to see them day by day, they don't know what the journey for them has been like in those last few days, to trust that, yes, they actually did have this virus, because they have to rely on just telephone conversations with the doctors they're speaking to, if their family member is, if they're unconscious and ventilated, or that patient themselves, if they're well enough to be on the phone. So how do you have a suggestion of how we can tackle that issue when people can't visit their family members, can't see their family members, how we can regain trust between patient, the medical professionals and their families? Does anybody have any suggestions of how we can regain that trust?
What's interesting is with those people that you're talking about, I don't know what your experience has been, but my experience when you're speaking to families and relatives of, sick patients, they're usually not they're not usually the type of people that believe in this 5G nonsense. They know that their relative is sick with the coronavirus, and they appreciate everything we're doing. And, they believe in this pandemic and, the virus that's going around. So I'm not sure, whether it's solely down to trust, although certainly I agree, I agree with everything that you said in that point there.
And to take it to a public health population level, I think we really need to stop overwhelming the healthcare system. So when there's so many patients, doctors can only do so much, and they can only attend to so many people. And so it kind of goes back to the misconception of the herd immunity, right? So if it's kind of like, let's just all get sick, and then we'll build immunity to it, and then it will go away. And that's a huge problem, because it's gonna create so many people going to hospital and being overwhelmed, and then not being able to receive the care that they can, because you have like one physician for like 200 patients or so, and it's pretty much at that point a huge mortality rate. And I've seen some stats, where it's like for the US to have herd immunity, 500,000 people need to die. There's going to be a lot of people need to be infected, and then 500,000 people would die. And then at that point, it's like 80% or 90% of the population has had the disease and has built some immunity to it. But there's huge, it's not even possible, because there's also so many strains of the disease. So you might have immunity to one strain, but not the other strain. And so it's just a mess, unless there's a vaccine that comes out that people can become vaccinated in a safe manner and build immunity in a safe manner. And then we'll, at that point. So in the meantime, stay home until there's a vaccine. Don't trust herd immunity. But I'm curious, maybe next session to hear more about the UK and the herd, we've heard some herd immunity kind of policies from there.
Well, the only country that's doing that at the moment is Sweden, and of course nobody knows if herd immunity is actually a thing with this virus, because we don't know whether you're actually immune once you've got it. So I've had the virus. I hope I'm immune, but I don't know. So I still have to be as cautious as everybody else.
Right, and we don't know how long immunity lasts, because it's just new.
Yeah. And so, Mohammed, what were you about to say?
That's exactly what I was. They already, Qaida and Mondo already kind of covered that. Because I mean, it's an ethical dilemma, to be honest. Let's say if we truly have everyone just go out and have everyone infected. The disease, from disease, kind of standpoint, the mortality, like you say, 80% will be fine, they will recover, but then there's that, kind of 15 to 20%. What will happen to those people? And then that will be the ethical dilemma. Who will be to say, this person should die versus that? What if that was you, and you were faced with that decision? And then the second thing is, how would you know that you will be healthy? There's no guarantees. Let's say, and I'm in your 20s, in your 30s, you're healthy. You haven't been really diagnosed with a medical condition that puts you at high risk. But how would you know that? Sometimes there's triggers that can cause you to have that disease. Have a disease. Like sometimes there's some autoimmune conditions that would just that just a trigger. That can be either an illness, or it can be just an environmental trigger.
Yeah,
and the coronavirus can be that thing that would trigger it.
And I think there's a lot of stuff that we're not going to know, I think, for another decade about what makes you more prone than others to be badly affected. And what you're saying is really important for a lot of young people that think that they won't get badly affected. Or there was that whole phrase at the beginning of this, which is it's just a cold or it's just a flu, and it will only affect the elderly or those with a lot of illnesses. And I feel that's a bit callous, because those that are elderly and those with a lot of comorbidities still deserve to live and to have good health. So we shouldn't dismiss them. And also, we have seen that younger people have died. We've seen people in their 30s. We know of like doctors in their 30s who've passed away, people that we thought of were fit and healthy. So it doesn't discriminate. Yes, you're less likely to be badly affected, to be critically unwell the younger you are, but that doesn't rule you out. We have had a few children pass away from it. So I think that's important. It's an important point you made there about, young people. You don't know if you will be the one that will be badly affected. So we all have to follow the same protective measures, especially for people coming up into the summertime that really want festivals to happen again, travel to like Spanish islands to be allowed. No, no, please do not do it. So there was one thing that somebody, Summer, mentioned about, if in a further conversation, if we're talking about the mental health effects of lockdown, social distancing, I personally have seen the mental health effects. Like, it's been quite detrimental for a lot of people, a lot of patients that I've seen. So first of all, I think we should come to an end here. If there's any final points that somebody wants to talk about before we conclude. Anybody want to?
Yeah, go ahead, Mandur. I'll talk after
you. It was just one more point with regards to the last thing we were talking about. In terms of this virus affecting younger and fitter people as well. Just one other thing to remind parents, really, because I see many parents taking their young children to the parks and, oh, my children will be fine, my children will be safe, they're only young, this thing only affects adults. I'm not sure what your experience is in America, Mohammed, but in the United Kingdom recently, we've had case reports of young children being, affected with an inflammatory condition that resembles Kawasaki disease. They become critically unwell very quickly, high fevers, rashes, swollen joints, and many of these young children have died. And this is something now that's being talked about in Spain. It's been seen in Spain, Italy, and the United Kingdom. And there's some suspicion that it's directly linked to the coronavirus. So it's just another thing really for parents as well, not to, think that, this thing isn't going to affect my children and, they can go around and play with any kids that, they're going to be fine. I think, everybody needs to be vigilant here, not just adults.
Yeah. But I think also the risk with children is that children are a massive risk to all the adults around them as well, which is why schools were closed down before a lot of other things in the society was.
Absolutely.
For pediatricians, for doctors, like we in A&E, we've been told, given very clear guidance of certain examinations that we don't do. We shouldn't look in a child's throat because the child may be well, but they will shed that everywhere and infect everyone around them. There have been cases where people speculate, multi-generational families where there's the child, the parent, the grandparents in one house, the risk to the grandparents in that situation because the children are little vectors for disease. So there's a lot, I think, a lot of risk, as well as what you talked about, Mandur, to the child themselves, but to everyone around them about being too lax on social distancing. Any other points that anybody wants to raise before we conclude this session?
Yeah, I just wanted to say, I want to thank you for, hosting this event. I think it was, hopefully everyone can benefit. But I want to, before we end this, I want to kind of leave it on a positive note. Is I don't want to equate coronavirus to death by any means. Coronavirus can be a very deadly disease and it can result in high mortality. But I don't want to equate the two. Because death can result from anything. It's not just from the coronavirus. People can die from, you can name it. You can, die from different conditions. So what I'm trying to say is, do the precautions, do the precaution, measures, stay away, still remain, still continue to do the social distancing and, disinfecting heart surfaces and whatnot. What I'm trying to say is, medicine doesn't really cure. It actually just, prolong life. It's all what it does is just really decrease suffering, really. I mean, that's all we kind of do. I mean, we don't really, I know we are termed the healers, but your body's doing the most of the work. I mean, we're just kind of guiding and helping you through the process of healing. So what I'm saying is, don't take coronavirus and equate it to death. I know it's a time of panic, but say don't panic. Inshallah, this time will be over. I mean, it doesn't matter. It can be long, it can be short, but at the end of the day, it'll be over at some point. So don't ever equate coronavirus to death.
Right. Thank you for that positive note to end on. So first of all, thank you everyone, Ghaida, Omnia, Mohammed, Mandur, Nidal, all for giving very different perspectives and really helping enlighten us and hopefully the people watching with your experiences and spreading information and not misinformation. There's a lot more we can talk about and I would love to have you all back for another session if you could, talking about, the mental health effects, how further to protect yourself, what to do if you do get it, anything that you should be doing, what to watch out for, when you should really be going to hospital, and also about any evidence for actual treatments now, looking into the future, any research or into testing, looking into future about, how our healthcare systems are going to change and respond to this. So there's a lot to talk about. But anyway, assalamu alaikum everyone. I hope the rest of, if you've not broken your fast yet, I hope you enjoy the rest of your day fasting. Inshallah, everyone else, take care.
Thank you.
Assalamu alaikum.
Assalamu alaikum.
Bye.